This is Logan, a bright, happy, and healthy 7-year-old. Yet she faces a challenging health future compared to the average Canadian child. Her life expectancy is almost a decade less. She runs 3 times the risk of developing diabetes and 6 times the risk of contracting HIV/AIDS.
When Canada is ranked against other nations, I think Canadians are always puzzled that we don't rank at the top on social indicators. And that is for one very specific reason, and that reason is the state of health and healthcare in First Nation Canada.
So today your blood sugar is 16.1.
For Logan and her family, the future is looking brighter thanks to a powerful internet tool, AtYourSide Colleague. AtYourSide Colleague has been developed by St. Elizabeth Healthcare, a charitable not-for-profit organization. St. Elizabeth is committed to help increase access to better care in Aboriginal communities across Canada. Today, it is making the commitment to contribute $2 million and the talent of its leadership team to make AtYourSide Colleague available across the country.
We'll put the knowledge in the hands of people that can use it.
For the past 5 years, St. Elizabeth has developed AtYourSide Colleague in partnership with 45 First Nation communities in Manitoba.
And if they change his meds, what happens?
I think our approach is, let's just do it. Let's get this out and let's make this certainly available.
The program was initially developed when St. Elizabeth Healthcare began to recognize changes in other industries.
So it was actually looking at the banking and other industries that had kind of put service on its head. And rather than people going to the service came to them.
That insight, the anywhere, anytime capability of the Internet, led to the development of AtYourSide Colleague. AtYourSide Colleague gives healthcare providers and community workers secure consultation with peers and experts, group forums and virtual classrooms, up-to-date information on issues like diabetes, wound care, and palliative care, trusted Internet links, and educational tools that are recognized for ongoing learning.
It isn't high-tech and complicated, and you don't need to have even a high-speed hookup.
The advantage is you don't have the big words that they have in those medical books that scare a lot of people off.
The technology has a clear and user-friendly interface. It provides in-depth information and powerful interactive features.
You can understand it. Like healthcare aides, newly trained healthcare aides in the community can get on there and understand and learn.
Remote communities in the north face many health challenges. Community members must travel great distances to obtain complex care. Few doctors and nurses actually live within the community, and those who do only stay for an average of 18 months.
She was very good, and it was a very tough time of your life. I know that. You had a hard time.
In northern environments, we're not only geographically isolated, but there's been a profound sense of isolation from our colleagues because of remoteness.
It's stressful because being the lone provider, people's lives depend on your decision. You feel isolated. You feel alone.
With AtYourSide Colleague's interactive capability, healthcare workers can connect with peers and experts in the larger healthcare community for advice and consultation.
For example, today there was a little girl with a rash, and not really being familiar with all the types of rashes, I've kind of used a doctor today.
We take a picture of that rash and then get a response.
Yeah.
Probably try this, whatever, within a couple days, which was great, the way it should be.
And there's always someone there to communicate with you.
In remote communities, lack of expertise and uncertain diagnosis often result in a difficult and costly solution, sending patients south to larger medical centers.
The trouble is that moving patients back and forth from their home community when it's not overly necessary is a huge burden, both financial but also emotional burden to the patients and to their family.
I have a problem getting in a car, in the vans. I have to hold my leg up really high to get out.
Okay.
For patients like Peggy, serious consequences may be avoided with up-to-date information on diabetes available at a local level. For her, the issue of travel is a difficult one.
I hate traveling. It's hard for me to go back and forth, especially with my grandson there. It's like keeping me. I keep it for my daughter. And he's lost without me.
Besides the stress for patients, the costs, especially for air evacuation, are enormous.
Sorry.
Many of these costs could be averted if problems were recognized and dealt with earlier.
ETA about 10 more minutes. Good.
The ability of nurses and their colleagues at the community level to detect the warning signs of complications as severe as diabetic foot ulcers is profoundly important.
How important? Early diagnosis and treatment of diabetic ulcers means patients can, in many cases, avoid amputation. AtYourSide Colleague also gives communities a powerful learning tool that can help them develop healthcare expertise.
Well, now we can even start training locally. It's building the capacity within the community.
If there's some skills that I need to brush up on, I'll look up there. If I need pictures or graphs, I'm able to access them and then continue with my learning experience as I do my job.
In Canada, it's been identified for a number of decades that the most important consideration in looking after the well-being of communities is to build capacity within the community to address their own needs.
Today, St. Elizabeth Healthcare is making a difference in the lives of thousands of Canadians.
This is bringing the best of Canadian healthcare to the place where it's needed most. This is using technology to deliver compassion. I think Roosevelt put it best when he said, you should judge a society not by what they do for those who have much, but for what they do for those who have little.
We're the highest numbers in statistics with anything detrimental to our health. That has to turn around, and it is our mandate to do what we can to ensure that takes place.
My hope for the future is to see St. Elizabeth in every First Nations community.
We're one organization that recognizes the need for action. Please join us as partners in supporting a different course for Aboriginal healthcare. You can visit us at stelizabeth.com or call us at 905-940-9655. Thank you.